in her study where they could actually buy a policy for those cheaper than what the federal government has implemented. You know, we were promised better access to care at a lower cost with the Affordable Care Act, and the TennCare program in Tennessee really was an experiment of nationalized health care confined to one state. And what we found was that more and more physicians, as you stated, were dropping out of the TennCare program because of reimbursement issues, but also because of the bureaucracy and the frustration with trying to find specialists. I had a primary care practice, and I actually had to hire an extra staff member, which drove up my cost, to sit after hours to try to find specialists to take care of these patients. Very frustrating for us, very frustrating to them, but yet the reimbursement compared to a private pay patient versus a Medicare patient versus a TennCare patient, continually was less money. So you're doing more and more work.
Will yield for just a second. So what you're saying is that you had patients under TennCare who had an insurance card, you just couldn't find anyone to take care of you.
Right, and that's exactly what we're going to see under the President's plan. You're going to see people who allegedly now have access to care, but they really don't because the reimbursement rates are so low that physicians really aren't even able to keep their door open. The reimbursement rate for a TennCare patient in Tennessee was almost half of that of a private patient. And it's not that physicians don't want to help and take care of these people. They do. It's just financially unfeasible, especially in solo practices, which are common in rural areas.
And again, if the gentleman would yield back, and you may or may not be aware of the study done early last year that showed that actually the outcomes in patients, whether they have private insurance or no insurance or Medicare or Medicaid, when you compare them, that Medicaid patients have the worst outcomes. In fact, 93% more likely to die of their illness than a patient with private insurance. They were more likely to die than even patients who had no insurance. And I don't know, is the gentleman aware of that finding?
Well, I have heard of that study as well, and again, I think it is an access to care issue, and that's certainly a problem that has not been addressed. The Obamacare laws does nothing to address access to care, and it does nothing to address cost of health care. And frankly, we all know that the cost of health care is driving our national debt. So we need to look at solutions that have been offered by the Republican caucus and the Doctors Caucus that will make real reforms to health care that make it more affordable and involve a greater attempt to get government out of the way. Just like in small businesses, the #1 complaint is that government bureaucracy is driving down the profitability, remains the same in health care as well. And we need to look at more free market options in health care if we're going to actually reduce costs.
If the gentleman would yield back, I'd love to bring the physician from Texas, gentleman from Texas, into the discussion, because women actually are specifically affected by the shortfalls in Medicaid, because the reimbursement rates for women's health care is frequently so low that it's actually hard to find an obstetrician to take care of those patients. And I know in Maryland this is the problem we had. In the 1st Congressional District, the Eastern Shore of Maryland, for a while, before we did Medicaid payment reform, you couldn't, women who were pregnant in that part of the state had to drive 3 hours to find an obstetrician to take care of them because the reimbursements were so low. And we know the Affordable Care Act does nothing for medical liability.
Correct.
And we know, for instance, that we have a cesarean section rate that's 35% now, the result of medical liability. We have obstetricians who have left the practice later in their careers of obstetrics and to gravitate toward just doing gynecology, where they join frequently large group practices. So we have left the practice of obstetrics to be an impersonal practice with people who generally don't have as much experience as those who have left the practice, and because of the lack of liability reform, a cesarean section rate that has roughly doubled over my career in dealing with obstetrics and obstetric anesthesiology. And I would like to hear the gentleman's comments on medical assistance and what it's doing for this country and for the women's health care in this nation.
Well, I thank the gentleman for yielding. And, of course, the doctor from Maryland makes an excellent point about having an insurance card, in this case a Medicaid card, does not necessarily guarantee access to care. And I would see it literally every month in my practice, being an obstetrician, if I'm called by the emergency room doctor to attend to a patient who is pregnant, under EMTALA laws, I got 30 minutes to show up or I get fined $50,000. So I would always show up. The difficulty is, though, that sometimes the problem that caused the patient, although she was pregnant, the problem that brought her to the emergency room was something unrelated to pregnancy, a heart murmur, tonsillitis, you name it. I may not be the best person to take care of that particular condition, but just as the doctor from Tennessee pointed out, it was almost impossible to find someone in a specialty practice who would agree to see that patient. And oftentimes, you'd find yourself admitting a patient who otherwise might not require admission, but just simply so you could get them the specialist care that they needed. A very inefficient and a very expensive way to go about getting that care.
If the gentleman would just yield for
Sure.
a very brief question, do you think that's the kind of health care the women of America deserve?
No, well, look, it doesn't have to be this way. And that's what's so disappointing about every aspect of the Affordable Care Act. Look, I don't want to get too far into it, but we know now that this law was written by the special interest groups, secret deals, down closeted in the White House. The Senate constructed deals Christmas Eve before a snowstorm to get out of town. This was constructed under the worst of possible circumstances. Should it be any surprise to us that the darn thing, regardless of how you feel about everything else, it's just not going to work. And yes, the gentleman pointing out the difficulties in obstetric care is just one aspect of that. If I could, I'd like to bring up the point, I was in the Supreme Court the day the oral argument was heard on the individual mandate. I heard the Solicitor General make his remarks or make his argument that, look, the cost of health care is going up because we have people showing up in the emergency room without insurance, and everybody needs to be compelled to buy insurance, and by golly, that'll fix our problem. Wait a minute. That ain't going to fix your problem, because we know in the state of Texas only 31% of doctors will see a Medicaid patient. As a consequence, if you expand your numbers of Medicaid patients and you don't have the doctors there to see them, what are they to do? They've got this card in their hand. They go to the emergency room to get the most expensive care. Now, I wanted to bring this up because in the Austin American-Statesman this weekend, Dr. Tom Sues, the executive director of the State Department of Health, or the executive commissioner of the Texas Health and Human Services, had an op-ed in the Austin American-Statesman, and I just want to read the first two paragraphs of his piece. Do you know how much a Medicaid client pays for an emergency room visit? How about if the visit isn't an emergency? The answer to both questions is the same. Nothing. Not one dime. The Texas Medicaid program paid $467 million for almost 2.5 million emergency visits in 2009. Half of those visits were not emergencies. Yet federal law makes it virtually impossible for states to charge even small copays to discourage unnecessary emergency room utilization by Medicaid clients. I think Dr. Sues has hit the nail on the head here. We have to provide the flexibility back to our states. But it also belies the question, who thought that taking a safety net program for blind and disabled nursing home residents, pregnant women, and children, and then expanding that to cover 15 million more Americans? That wasn't the way to go about this. There were better ideas out there. For whatever reason, the Obama administration chose not to listen, not to solicit those ideas, and now we have the situation as it exists today. But I thank the gentleman for yielding. I thank him for allowing me to participate in this hour. This is an important subject, one that is not going to go away, and we're going to be talking about it a lot for the next several months and the next several years. Now I'll yield back.
And I thank the gentleman from Texas. Again, you know, we have on the floor with us now 2 obstetricians and obstetric anesthesiologists. You know, if women are ready for childbirth, we're ready on the floor of the House tonight. But you know, the gentleman makes a great point, because in the end, having an insurance card doesn't guarantee access. Having an insurance card doesn't guarantee affordable care. And as we know, the Affordable Care Act, what it did is to pretend that real economics don't exist, to pretend that the laws of mathematics don't count, that we can expand this program, as the gentleman pointed out, a program that was meant for a safety net for the poor elderly, for women, for children, and we expanded it well beyond that to the point where, as we brought up earlier in the hour, if gone unchecked, it will bankrupt everything else in government. And the time has come for, as the gentleman has pointed out, for us to reconsider that, to reconsider whether that Affordable Care Act was the right approach. Now, we know that just today, the Congressional Budget Office has rescored the President's Affordable Care Act and has said that as a result of the Supreme Court decision, because one of the goals was to ensure as many Americans as possible that an additional 3 to 4 million individuals will not be insured as a result of the Supreme Court, because the states will make a rational decision that they can't afford to let their budgets go bankrupt through this government, federal government mandated expansion that does nothing to control cost and does nothing really to increase access other than putting a card in someone's hand. And as the graph shows, that card doesn't help all the people who are in these pink bars. They're the ones with a Medicaid card currently, and their chance of seeing a specialist is somewhere between 17% and 57%, because the government payment is so low, because these programs are so expensive and never adequately budgeted for, just as is in the case in the Affordable Care Act. Now, we're joined this evening by my colleague from Georgia, Dr. Gingrey, who's also an obstetrician, who has spent years taking care of patients, understands what it will take to fix the health care system in the United States. And I'm very interested to hear your perspective, Dr. Gingrey, on the topic we're discussing tonight, Medicaid and its expansion under the Affordable Care Act.
Mr. Speaker, I thank the gentleman from Maryland, my physician colleague, for yielding, and I missed some of the hour. I regret that, and hopefully I'm not repeating some remarks that have already been made. But even if I am, I think it's important for people to understand that Medicaid expansion is threatening each and every one of our 50 states and the territories. The provision in the Affordable Care Act, Obamacare, that's titled Maintenance of Effort. And actually, this maintenance of effort provision, Mr. Speaker, began even before the passage of Obamacare. Obamacare passed in March 23, 2010, a little more than 2 years ago. It just extended this. But what happened with the stimulus package back in 2008, states were told that they would not be allowed to purge their rolls of people that were at that point in time under Medicaid to see if perchance they were in this country illegally and not eligible, or their income level had risen to the point that they were doing just fine, thank you, maybe making $50,000 a year and could afford their own health insurance premiums, not to be paid for by we the taxpayer and the citizens of the state of Georgia, my great state. So since 2008, and then it was extended with the passage of Obamacare to say that through the year 2013, these states could not do that. Well, what's happened is, I've got some statistics, and just to quote from the National Governors Association report, states are facing a collective $175 billion budget shortfall through 2013, in large part because of this maintenance of effort requirement under Medicaid, that they're not allowed to make sure that the people on the Medicaid program are the ones that need to be there, the most needy, that can't afford, their children can't afford health care. And now these roles are sort of set in stone until the year 2013. And in many cases, Mr. Speaker, they include childless adults. Childless adults who maybe were eligible to get on the program at a point where their income was very low, or maybe they were out of work. But now, you know, shouldn't the governors be allowed, at least on an annual basis, if not every 6 months, to look at those rolls and make sure that the dollars for health care are going to the folks that really need it and their children. That's what the Medicaid program was all about when it was started as an amendment to the Social Security Act back in 1965. So I wanted to mention that. It may have already been talked about earlier. My colleagues in the Doctors Caucus of the House that know of what they speak in regard to health care. There are a lot of other issues in Medicaid, but I thought in particular I'd want to discuss that and, you know, just conclude my remarks. I'll be glad to yield back to my colleagues and continue to listen and maybe comment on some other issues. But in conclusion on this point, if allowing a state to improve its enrollment and its verification system saves enough money to keep our children's education program intact and the safety of its citizens in regard to police and fire protection intact, why wouldn't we support this change? Why wouldn't we repeal this maintenance of effort? If given governors the ability to manage their own Medicaid programs prevents drastic cuts to education or job creation programs, why in the world would we not support that? The only reason I can think of would be to force, under Obamacare, more and more people into the Medicaid program where the states have to eventually do that FMAP and that sharing of the cost, because otherwise they'd be in the exchanges and the subsidies, as we know, go up to 400% of the federal poverty level. It's all part of this grand scheme to eventually have national health insurance, Medicare for all, if you will, and it's got to stop. And I'll yield back to my colleague.
Thank you very much to my colleague, the obstetrician from Georgia, who points out, it's the graph that the gentleman from Louisiana showed before, Medicaid expenditures now exceed K through 12 education. And as the other chart we've seen shows, we're over at the left-hand side. It'll only get worse over time. And I'd like to yield to the obstetrician from Texas, the gentleman from Texas.
Well, I thank the gentleman for yielding. I wanted to make one point on this new Congressional Budget Office score that was provided today. And I know some people are looking at that and saying the cost for the program for the Affordable Care Act over the next 10 years was only scored, I think, at $1.16 trillion, if I can use the words only and trillion together in a sentence. But what many people overlook is the Congressional Budget Office must score under existing law. And one of the things that existing law does is cut physician reimbursement in Medicare by 35% on December 31st of this year. So add another $300 to $400 billion to that cost just for the so-called sustainable growth rate formula, which has not yet been repealed. Now, we will fix that before the end of the year for at least one more year, but the Congressional Budget Office has no way of scoring that. They must go with existing law. The other thing that is, and of course the Independent Payment Advisory Board, same thing applies. They have to think that those cuts that the Independent Payment Advisory Board is programmed to produce, that they are going to occur. The other thing the Congressional Budget Office cannot easily estimate is the number of people who will be moved off employer-sponsored insurance onto the state exchanges or the federal exchange, and that is a difficult number to know. The Kinsey Corporation said it was going to be 30%. The Deloitte Corporation has said 10%. We don't know what that number is. CBO is scoring that at a very low 1 to 2% because historically that is the average of the erosion of employer-sponsored insurance. Those points are important to remember in looking at these figures. Now I yield back.
And I thank the gentleman. Thank you. I yield back.
Gentleman yields back. Under the Speaker's announced policy of January 5th, 2011, the gentleman from California, Mr. Garamendi, is recognized for 60 minutes as the designee of the minority party.
Mr. Speaker, thank you for the privilege, and for my colleagues in the Republican Doctors Caucus for a most interesting but factually incorrect 45 minutes of debate here. We're going to spend this evening talking about jobs and about the American Jobs Act and one of the great woulda, coulda, shouldas of our times. I'm going to hold that for just a few moments because there are a few things that really need to be discussed from the last half hour. First of all, most of the discussion was about Medicaid. That's a program, a national program, in which the federal government pays about 50%, it varies state to state, but roughly 50% of the cost of providing medical services to the poor women, children in the states. Now, the debate was most interesting in that the argument was that there would be a lack of access, and simultaneously an argument that there were no cost control. Yet, if you were listening to our esteemed colleagues, you would have heard them say the doctors are not paid enough. I think if they're not paid enough and the doctors want to get paid more in order to provide services, then the costs are going to go up. And so the cost control argument here doesn't make a whole lot of sense. If you want to keep the cost down, you need to improve the effectiveness and efficiency of the system. And certainly certain services within the Medicaid and Medi-Cal, as we call it in California, are not paid sufficiently. Some other services are paid more than enough. So you need to balance that up over time, and all of these programs are run by the states. It's really the state that decides what the reimbursement rate is going to be. The federal government then matches the state's contribution. So the argument really didn't make a whole lot of sense. And even more so, in the Ryan Republican budget, which has passed this House twice now, there is a significant reduction in the educational services for doctors, so that the money that we, all Americans, spend to educate doctors, particularly in the that part of the program, both the basic education and then in the residency programs, the Ryan Republican budget significantly reduces the amount of money available for residency programs for family care practices, for the very basic programs that we all want to access. So for family care, for basic care, that money is reduced. And you go, well, wait a minute, that doesn't make any sense. If you're down here on the floor arguing that there's insufficient number of doctors and they're not paid enough, then don't argue at the same time that it's too expensive and there's no cost controls, and please don't argue that there are not enough doctors. Because, in fact, the Affordable Health Care Act expanded the number of residencies for the very basic care, for the family practice programs. So I'm not quite sure I understand what they're arguing. In addition to that, access across this nation for millions and millions of people is provided in clinics. These are the community clinics that a large population attend those community clinics for their basic services, and most of those are the Medi-Cal or Medicaid population and the very poor that are not yet enrolled in what will be the expanded Obama Cares program. So what do the Republicans offer us? The Ryan Republican budget would cut by more than a third the support for the clinics, closing thousands of clinics across this state, across the nation, and in my state, where people get access. So please do not come down here on the floor and argue for an hour or half an hour that access is being delayed when, on the one hand, you are cutting the money for access. That's what the Ryan Republican budget does. It cuts the money for access by reducing the residencies and reducing access to clinics by cutting by more than a third the money that is there to build up the clinics, the community clinics where people get care. In addition to that, I'm going to take a deep breath here. I don't want to get wound up too tight about this issue. I want to ask my colleague from New York, Mr. Paul Tonko, to talk a little bit about the Medicare portion of this.
Absolutely. You know, We didn't hear anything about what would be lost in the process of their cuts or their repeal of the Affordable Care Act. And Representative Garamendi, you're absolutely right. There is much that has been gained by the American population, the health consumers across this nation, with the efforts of Affordable Care Act. To close the donut hole, to make prescription drugs more affordable for our pharmaceutical consumers out there, for seniors who require this medication, their prescription drugs, to stay well or to stay alive. Far too many were balancing their household budget by reducing their intake of prescriptions advised by their medical community. That is immoral, it's unnecessary, and has been addressed by the Affordable Care Act, so that 5.3 million seniors today are drawing $3.7 billion in benefits. That is something that could be taken away if the Republican majority in the House of Representatives had its way. Now, this is a wellness aspect. This is a part of a formula that allows people to be cured, to be healed, to be allowed to live in a quality of life that then addresses their very needs. And so I think it's necessary to point out what would be taken away from already the benefits offered, and there are more to come. But as we know, they're staged, they're rolled into the operations of reform over the next several years. But suffice it to say, the screenings, the annual checkup, flu shots that are made available without cost, no co-payment, no co-insurance, no deductible, is required here. These are huge benefits to every age demographic that are offered through the Affordable Care Act. And so we heard about adding to the cost curve of health care. We've heard about repealing the Affordable Care Act. We've heard about taking away the benefits that have just recently arrived at the doorsteps of health consumers across this great nation. And why would you want to play politics with the very fabric of quality of life of the people that we represent collectively by undoing progress? This is a recurring theme. You know, they want to undo Social Security that has a 76-year-old history. They want to voucher out Medicare that came to us in the mid-60s that addressed the economic stability, the predictability of senior households, and the quality of care, the quality of life in those households. Why would you want to take that progress away? It's heart-wrenching to listen to some of this insensitive, callous dialogue on the House floor that really renders the public that we're here to serve without benefits that have just recently arrived through the success of the Affordable Care Act. And Representative Garamendi, it is something that I think needs to be echoed out there from this House floor and then shared with the constituents of this great nation in a way that allows them to better understand what is part and parcel to the Affordable Care Act. A monumental piece of success. Is it perfect? No. We aimed for perfection. We struck with progress. But there's many a benefit that is part of the Affordable Care Act, and we're witnessing an attempt here, an all-out attempt by the Republican majority to turn that success into failure.
Well, let me pick up on that, Mr. Tonko, and you're quite correct. It's not just an attempt. There have been 33 votes on this floor by the Republican majority to either terminate completely or to eviscerate in part the Affordable Health Care Act. Now, what would be eviscerated? First of all, the Ryan Republican budget would terminate Medicare as we know it and give to every American who is not yet 55 years of age a coupon. It basically says this coupon is worth 70% of the cost of insurance. Go get your insurance when you become 65 from a private insurance company. No longer would Medicare be available to all of those people who will eventually be 65. And for those people that are 55 to 65, it makes it impossible for Medicare to go forward on a financial basis because it takes away the younger people. I heard something on the floor which I just said, wait a minute. Some statistic that was tossed out here just a few moments ago that more people die on Medicare than die on regular insurance. Yes, Medicare is for the elderly. Medicare is for the elderly. Yes, they do get medical care, but eventually they get old, and yes, and I will too, be on Medicare, and I will die on Medicare, and I'm so grateful that I have Medicare available to me when I become 65, because I know I've got a solid insurance program. I know that I'll be covered, and I know that my younger brother and sister will be covered when they become 65. They will have quality care, and guess what? They will die on Medicare. Yep, that happens. You're on Medicare for the rest of your life. It may be for a year, it may be for 30 years, but whatever, you've got a guaranteed benefit that's available to you. And what do you lose if the Ryan Republican budget and the effort to repeal Medicare is lost? Well, let's see. Nearly 13 million Americans will benefit from $1.1 billion in rebates from their private insurance companies that are presently overcharging them. 86 million Americans, including 54 million Americans on private policies and 32 million Americans that are on Medicare, will lose their free preventative services. Now, you want to reduce the cost of health care, then you've got to make sure that people stay healthy as long as possible. And how do you do that? Blood pressure. You want to deal with blood pressure? Okay, it's very cheap if you get your medicine, but you've got to find out about it, so you need that free checkup. Diabetes, stroke, all of those things can be delayed and often prevented if you know it's coming. So, what are we talking? 32 million seniors will no longer have a free checkup, preventative services. In August, just a week from now, women will begin receiving free coverage for comprehensive women's preventative services, Pap smears, breast cancer checkups. You want to repeal that? That's what the Republicans have voted 33 times to do. Repeal the free checkups for women in America. 105 million Americans will no longer have a lifetime limit. Let me put that a different way. 105 million Americans will have a lifetime limit once again. Today, they do not have a limit. So if you're 30 years old, you have a private insurance policy, and you get cancer, you'll hit that lifetime limit immediately, not under the Obama Cares program. That program, there are no lifetime limits, and you'll continue to receive the medical benefits. Mr. Tonko?
Well, thank you, Representative Garamendi. You know, one of the things you talk about with the influence or the focus on women's health care reminds me of the pre-existing conditions that are precluded now as a rationale for denying insurance. Yep. And pre-existing might mean in youth, asthma, in our senior population, emphysema, or cancer recovery, or cancer struggle. But it can also mean, in a gender-related bias, being a woman. That is used as a pre-existing condition. Being a woman, a pre-existing condition. So the benefits to women, as you outlined, in the direct services, the screenings, the mammograms, and the like, are a portion. The other portion is just being born a woman can deny you insurance. So, you know, when you talk about the 30 cents on the dollar that the voucher would carry for the Medicare recipient, and they're asked to go shop, this is saying that compared to today's standards, it's the senior digging much deeper into her pocket. It's the senior digging into another pocket to be able to afford his Medicare voucher portion. And that's unacceptable. That is playing to a special interest. And that's what I believe the espoused virtue of this deny, this repeal is about. It's about playing to special interests that don't want to be told that there's a transition here, that there's a new day in America for healthcare consumers, and that the heart has been poured into this to be more sensitive, to address a moral compass that this nation has always uniquely embraced, that we are a compassionate society, that we are going to make a difference out there, that we are solutions bound. And that's what the Affordable Care Act was about, presenting a new approach to health care, providing more freedom and opportunity to our seniors, to our children. If you're 26 and under, staying on your parents' policy. These are the formulae for success that allow us to go forward with much more dignity, much more success, cost containment, affordability, accessibility. These are the dynamics of reform. And why would you repeal something here other than to respond to special interests?
Well, exactly so. For 8 years, in the early 90s and then in 2000, I was the insurance commissioner in California. I wish I had this law, because I could have held the insurance companies responsible. Now, my attitude about them is they always put profit before people. However, the Affordable Health Care Act has what we call the Patient's Bill of Rights. And this is the insurance discrimination that is eliminated by this law. And you spoke of a couple of these issues. Discrimination against a woman simply because they're a woman. They have a pre-existing condition. They're a woman. They can get pregnant. So the insurance companies would not cover, or they would charge more. Those days are over. Also, a young child. There are about 17 million children in America with pre-existing conditions that can no longer be discriminated against by the insurance company. They have to be able to get insurance from an insurance company. 17 million children, one of whom is the son of my chief of staff, born with kidney failure. He had insurance the day he was born. He immediately lost insurance because he had kidney failure. And today, as soon as he leaves his parents' policy, which he's able to get now under the law, because they cannot discriminate against children, he will be able to continue to get insurance. Under the old law, repeal the Obama Cares law, and he will be denied insurance because there is an end to the Patient's Bill of Rights. The Patient's Bill of Rights guarantees that insurance discrimination is over. So what do they want here? What do the Republicans want from Americans? A big question. Apparently, they want more money for the doctors, and that's certainly necessary in some cases. Apparently, they say they want government out of health care. Does that mean end Medicare? Apparently, yes, because the Republicans have voted twice on this floor to end Medicare, as we know it. You'll get a voucher. You will not have guaranteed coverage. You'll have to go out and shop for it yourself. Apparently, they don't want community clinics because they've already voted on this floor to cut about 1/3 of the community clinics in this nation. Apparently, they talk about access, but at the same time, they refuse to fund the residencies for family care, for the basic health care providers that we need in our hospitals, in our communities. And apparently, they want to eliminate the Patient's Bill of Rights. This is not a formula for America's health care. Now, we also heard on this floor a few minutes ago, a half hour, 45 minutes ago, that the nonpartisan Congressional Budget Office said that because the Supreme Court eliminated the mandate that states have to provide more Medicare coverage, Medicaid coverage, there would be fewer insured. True. That's true. Texas has refused to increase its Medicaid program. Well, that's Texas' decision, and I'm sure the governor and legislature will have to address that. But the fact here is that the Medicaid coverage actually provides the opportunity for some 17 million Americans to get insurance that do not now have insurance. And if we provide the clinics, if we provide the residencies for the doctors who would be able to care for them, they will have access. And I can assure you that if we also do the preventative services, we will see a decline in the number of severe cases. People will not get so sick that they have to go to the emergency room. They'll get care early, and with the drugs that are necessary, they'll be able to avoid the very expensive illnesses. That's in all of our benefit. You mentioned vaccinations. These are all ways of reducing costs. So here we go. Once again, debating something that is now the law, that is proven to provide services to Americans, whether they are seniors or whether they are young, whether they are children. It works, and it's working for America today.
Well, if I might ask the gentleman from California if he would yield. I believe there's a whole lot of political posturing going on with the Medicaid decision by states. And, you know, you're hearing a lot of talk about, well, we're not going to pay for that portion because, well, while it may be 100% in the near future, it may go to 90% into the long-distance future. And they don't want to pay anything for the new installment of a Medicaid plan. Well, today we're paying. It's not like it's against an absolute that costs nothing. If you have the poor, uninsured, underinsured, in any given state, there's indigent care. There's bad debt and charity that is addressed in ratepayer dollars for insurance coverage sake, because that is going to be incorporated into the overall actuarial plan, or you're paying for it through taxpayer dollars, and for a much more inefficient system. To have the poor and uninsured and underinsured to go to emergency rooms, visiting a different doctor team every time they visit that emergency room, or perhaps a different emergency room, to not provide the stable, standardized care, acceptable notions of how to provide a predictable outcome, you're going to pay needlessly and wastefully. And this is about networking people to a system that provides a stability, a standard that will enable them to have a clinic, have a contract that will cover them and make certain that all of us are strengthened by it. And guess what? The business community, we talk about competitiveness. We talk about a sharp competitive edge for America's business community as they enter into the international sweepstakes on winning contracts, and that translates into providing jobs and profitability for our business community. Well, part of their cost of doing business is to have health care for their workers. Many want the health care coverage for their workers, but simply cannot afford it. And so the exchange opportunities that are part of the package of Affordable Care Act enables them to cut their costs. It's taking their experience, their actuarial experience of 10, 15, 20 workers in that small business and putting them in a pool of millions of workers that enables them to shave the peaks and enables them to take those catastrophic situations. One person in their plan of 10 impacted by catastrophic situations can cause their premiums as a company and the co-payments of their workers to skyrocket. But if they're enabled to join this pooled effort, it provides for a better outcome for everybody. So there is wisdom and thoughtfulness poured into the reform elements of the Affordable Care Act. And it's done again with that American heart, that spirit, that sense of compassion for the worker, the sensitivity toward the employer, and putting together a package that has everyone responded to in a way that speaks to a long overdue bit of success. The last industrialized nation, Representative Garamendi, to go toward a guaranteed health plan. So long overdue, and now to taste success and have it pulled away from the American healthcare consumers of this great nation is a very troubling notion.
Well, Mr. Tonko, thank you very much. Next Monday, did you know, next Monday is the birthday, the annual birthday of Medicare. Next Monday. 1965, it went into effect in 1965, and ever since, as you said earlier, Republicans have been trying to terminate it. They tried again this year, but the American public knows better. They know that they want to live long enough to get to Medicare because in Medicare they have a guaranteed benefit. They know that wherever you are in the United States, whether you are in Vermont or in California, you have the same quality policy that will cover most of what you need. If you want more, you can go out and buy that. That's called the Advantage Program, and you get to choose your doctor. It's not a government takeover at all. In fact, it is a financing mechanism so that every senior in America can choose their own provider. They get to choose their provider. They can go wherever they want to go to get their medical services. And if they don't like the doctor, they can change. So the government is not saying where you can go. In fact, the government is financing the system so you can choose whatever provider you want to choose. It's a common policy across the nation. And it is efficient and it is effective, and the Republicans are trying to destroy it. We won't let that happen. Bottom line, we will not let that happen. And there are serious cost containments in the current Medicare program and in the Affordable Health Care Act. And I'm just going to end with this, and then we really need to get to what we wanted to talk about, which were the job programs. The Congressional Budget Office today estimated that the Affordable Health Care Act over the next 10 years will reduce the deficit by $109 billion. And in the 20 years going out, because of the cost containment in this system, the Affordable Health Care Act will reduce the deficit by over $1 trillion. Now that's worth engaging. That's worth us doing, and simultaneously provide far better health care to Americans and far better access to health care wherever they may need it across this nation. It's a good thing. And when they want to stand up here and say Obamacare, I'm going, you're right, Obama cares deeply about the very health of every single American. And that's why the Affordable Health Care Act is in place today, was found to be constitutional, does reduce the deficit, and does provide quality health care and choice of where you want to get your medical care.
My colleague from California just indicated that there would be a favorable deficit outcome because of Affordable Care Act.
Exactly.
Well, what else reduces the deficit? Putting people to work. Putting people to work, the American Jobs Act. Plain and simple, it's about addressing the deficit and providing for the dignity of work and the enhancement of services that strengthens the fabric of our communities, our states, our nation. So the American Jobs Act, according to experts, is a phenomenal plan. You know, we've heard the Republicans say we have some 30 bills that are about growing the economy and producing jobs when, in fact, when put under the test, when reviewed by some very sound organizations out there and professional economists and analysts, said it would do precious nothing. That it was not the formula. It's not what the doctor called for, if we can stay on that health care-related theme. But the American Jobs Act, well, you know, listen to some of the experts. The chief economist at Moody's Analytics, who, by the way, Mark Zandi, was the former economic advisor for Senator John McCain. And what does he theorize? That anywhere from 1.9 million to 2 million jobs would be the outcome of the American Jobs Act, something that not only produces the jobs, but would reduce the unemployment rate by at least 1 percentage point. That's a major significant factor. And what also happens is that when you produce those 2 million jobs, you're addressing the GDP. The GDP by at least 2 percentage points. Growth in the GDP, reduction in the unemployment, reducing the deficit, putting people to work, strengthening the economy, providing purchasing power at a time when businesses are saying the best thing you can do, get us customers. A healthy economy, putting people into the work mode, creates customers. It creates purchasing power. It creates a strength in the economy. 2 million jobs. How can we walk away from a proposal? Oh, I know why. Because there were those who spoke before cameras, reaching all of America, saying anything this president offers we won't do Our goal is to make him a one-term president. My friends, that is putting partisan politics, petty partisan politics, ahead of the interests, the better interests of the American public. Where is that American spirit? Where is that sense of patriotism? Where is that sense of responsibility, of leadership in this House and in the U.S. Senate that needs to go forward with the American Jobs Act? Representative Garamendi, I know we've been joined by another colleague, and it is just great to share this hour with you to talk about the progress we can taste that would lift every community in this great nation.
I was reading one of the Hill magazines, often called the Hill Rags, and they said that the Speaker of this House starts off his weekly press conference by asking, where are the jobs? Well, the jobs, Mr. Speaker, were proposed last September by President Obama, called the American Jobs Act. 2 million jobs minimum could have been created. This is one of the great woulda, coulda, shouldas of our time. We could have people back to work today, and in doing so, reducing the deficit. There's so many different pieces of this. So, Mr. Speaker, the American Jobs Act are where the jobs are. You talked about a piece of it. I'm going to just pick up one more, and then I'm going to turn to my colleague from Oregon, Mr. Blumenauer. This is one that speaks to the American homes. What's going on in the house where we live. Many of those homes are run down. They have problems with insulation, or they don't have any insulation at all. They leak energy. Well, the President proposed, as a piece of the American Jobs Act, that we could provide construction jobs, really low-skilled construction jobs, in rehabilitating the American homes. This is not a new concept. This has been going on for some time. And it's been used repeatedly to upgrade homes in the United States and simultaneously save energy and save dollars for the American public. One piece of it, construction jobs, could have been put in place. So the other one, and I'll just let, and then I think Mr. Blumenauer, if you're not ready yet, okay. I'm going to pick up another one, then I'm going to turn it back to you, Mr. Tonko. My daughter's a teacher. My son-in-law is a teacher. They've seen their class size just grow from 22 to some 32 people in the class. Now, this is a serious problem for the teacher, making it more difficult to provide the quality teaching that's necessary. My daughter's a great teacher. My son-in-law is too. But it's much more difficult. The class size has increased by a third. The American Jobs Act would have put 280,000 teachers back into the classroom. Now, if you happen to be a second grader and you're not getting what you need to learn, then that's going to carry on through the remaining years of your schooling. And so 280,000 teachers could have been brought back into the classroom had the Affordable Health Care, the American Jobs Act passed. Mr. Tonko?
Yes, they are both significant bits of legislation, so it's good to interlace the American Jobs Act and the Affordable Care Act. To the 280,000 teachers, you know, I think it's very easy to state that the human infrastructure in our school systems across this nation are a critical component to quality education. That personal relationship of students to teacher, the exercise of self-discovery. Who am I? What are my gifts? What are my talents? What are my passions? That is exercised in the classroom. That is a spirit that prevails. It's a magic that happens in the classroom, and that sense of self-discovery. You know, part of our goal here is not only to enable these students to understand who they are, to draw forth the soul of the individual, it's to provide the opportunity for our workforce of the future. That fourth grader, hypothetically, that was impacted by class size or the lack of a teacher for certain subject areas, that's something that child will never gain again. What you lose in that given year is lost throughout the development. And it is important for us to make certain that every bit of opportunity, every bit of learning experience is granted our children so that they understand where they can best contribute to society, where their gifts can be utilized. And it's part of that development of the workforce of the future, the workforce of the present, training, retraining dollars that are part of the American Jobs Act. Absolutely a critical piece of the infrastructure. And the tens of thousands, this chart will say retain thousands of police officers and firefighters. We know it's tens of thousands across this nation. An element of public safety, a quality of life component, making certain that our core communities have the given workforce of firefighters, of police officers that will enable us to respond to public safety measures. These are a core bit of principle, along with veterans that would be hired with benefits that are significant. That element was done under pressure, under scrutiny, under growing public sentiment. But think of what could happen if we did all of these and did even additional services with our veterans who are returning home and are in need of employment. These are the factors, these are the dynamics that are introduced through AJA, the American Jobs Act, that would allow for the deficit to be addressed and at the same time to have services responded to, essential services. You know, it's all we've talked about, the belt tightening, addressing waste and inefficiency and outmoded programs and fraud. And after we capture those savings from that exercise, it's important, I believe, to slide that into an investment zone so that the result is cut where you can so as to invest where we must. The investment, absolutely critical, the investment in jobs, the investment in teachers, firefighters, public safety elements, our police officers, our veterans community, and items like an infrastructure bank bill, an infrastructure that we'll talk about in the remaining minutes of this special order.
Well, let me just pick up a little more on the education. The most important investment any society will ever make is the education of their children and the re-education of their workforce. In the American Jobs Act, there is the 280,000 teachers that would have been in the classroom this entire year. They're not there today because there's been no movement on this floor to even debate in committee, let alone take up for a vote on this floor the American Jobs Act. Also, many of the schools across America are run down. Their laboratories, their classrooms are antiquated. They don't have air conditioning. Many, many other problems. The American Jobs Act provided money for 35,000 schools across the United States to be upgraded, to be rehabilitated, so that 250,000 jobs would have been created right there. Before we go any further, I know you're all worried, oh, it's going to increase the deficit. The American Jobs Act would increase the deficit. No, it would not. Mr. Tonko, you spoke earlier about when people go to work, the economy gets going, money is circulated, taxes are paid. The other part of it is the American Jobs Act was fully paid for by ending unnecessary tax subsidies to companies that don't need it, specifically the oil industry. The wealthiest industry in the world would lose its tax breaks that amount to over $16 billion, and that money would come back to pay for Americans going back to work. There are other things. The top-end tax, at the very top end, the wealthiest 2%, would see their taxes go back to where they were during the Clinton period. This is how the American Jobs Act was going to be paid for. Mr. Tonko?
You know, I think it's interesting, too, because we're talking about the jobs created that impacts the unemployment rate, that impacts the reduction of the deficit. In contrast, the Ryan budget, which we've talked about many times, the Republican plan for this House that's been adopted by Republicans that are in leadership and running for president, would, in contrast, according to the Economic Policy Institute, the cuts in services would result in a reduction of 1.3 million jobs in the first year and 2.8 million jobs in the second year.
Excuse me. 4.1 million jobs total.
So when you contrast that, so that cut in jobs, the cut would be part of the Republican budget plan adopted by this House, would grow the deficit. Because if we're arguing that employment reduces the deficit, unemployment in contrast to the American Jobs Act, would drive up the deficit. You know, it's going back to the failed policies of the past. We fought 2 wars that were never put on budget. We offered trillions in tax cuts that we couldn't afford, and we avoided talking about paying for the war. Do we think there was going to be a crash? Did we think that that behavior wouldn't come with a price? Of course it had to extract the price from the American society, and it was the loss of 8.2 million jobs. It was the loss of as many as 800,000 jobs a month. It was about bringing America's economy to its knees and draining trillions of dollars from households that trusted that their investment with the private sector, with the financial industry, was going to return them lucrative dividends. We saw the failure of those policies. Why would we go back down that road, which seems to be what the Republican plan, the Republican budget is all about?
Well, if you look at, excuse me for interrupting, but if you look at what the Ryan Republican budget would cut education and other services by 33%.